Welcome to Adapting Class. Top 5 cardiac medication that keep on showing up in the NCLEX or nursing school. These are medications that require some mastering. We're going to use critical thinking, 15 questions, give you safety information, prioritization, how to recognize them in the SATA, in the simple form. I yield questions. Some of the questions may be hard, but that's the purpose of it. Let's get this done. First question, as you can see, there's an EKG associated with the medication. I know you know it. Don't worry. Don't freak out. A nurse is caring for a client on a cardiac unit. After reviewing the ECG strip below, which prescribed medication is most likely responsible for the ECG abnormality observed by the nurse. The first thing you do is to go for the buzzword. They say responsibility from that medication is what is causing that EKG finding. That's all. All that they've said doesn't mean anything. What do you think? This EKG, if you read it, you can see this is what. You can stop the video and then answer the question and then you listen to me on how I approach it. I'll read the EKG and the EKG look at what? Bradycardia. Therefore, if it's a bradycardia, I'm going to pick a prescription that is going to slow down my heart, right? And we're talking about cardiac medication. Then you start using a test-taking strategy. I know this is bradycardia because I can see the RR interval is too long. From here, 1, 2, 3, 4, 5, 6 is too long. 6 over what? And 300 over 6 will give you 50. So this heart rate is low. Therefore, which medication causes that? There's a class of medication from cardiology that usually will slow down your heart rate. The most common one is the one that starts with the law. That's all. That's the one. Calcium channel blockage does that. But the one we start with the law is the beta blocker. I look at the answer choice and I see what? Spironolactone. It does not have law. Enalapril. This has pr at the end. This is ACE inhibitor. Bisoprolol. Even if I don't know the beginning of the words, the last 3 are okay. It's a law. I'm picking it. Bisphosphonate has no law at the end. Therefore, what is responsible for that? It's a beta blocker slowing down the heart rate. So we'll be doing these NCLEX questions and answers in the detail. I'm giving you the detailed explanation so that you can figure out what is going on. You should take a note and everything that's said, or you can answer the question and see how I approach it. So the first one is what? Bisoprolol is what is responsible for this bradycardia. What is the next class of medication? The nurse is reviewing prescription for several clients receiving what? Lisinopril. Try to make it so challenging so that you can learn, because we're going to learn. It's a content and clear questions and answers with rationale, detailed rationale. So that's why I make the question like that. So we have Lisinopril. It's a class of medication known as what? ACE inhibitor. They have their own side effect. Which of the following clients should the nurse question the prescription? What do you need to know? The next thing you need to know is what kind of class medication, what is the side effect? This is the name of those medications. The Pro and the Lisinopril. Lisinopril, the major side effect is called ACE, which is what? Angioedema, cough, and what? The E is basically electrolyte abnormality. There is another one, I, which is, I usually had it to is as teratogenic, right? So ACEI, which is the ACE inhibitor, are the side effect. How did they do their thing? Through the renin-angiotensin system, they end up increasing your potassium and therefore decreasing your sodium. And this is how they control your blood pressure, the renin-angiotensin system. In the process, the side effect is through the mechanism of the renin-angiotensin system. Therefore, what do you think? Stop the video, pick your answer. What do you think? The first one is what? ECG, why HCG positive. HCG positivity means you're pregnant. Teratogenic means you cannot have it. The client with creatinine of 2.3 2.3 will increase your potassium. These medication increases your potassium. Therefore, I should worry about it. A client with a blood pressure of 150/60, that means we're using this medication to control their blood pressure. This is okay. A client on what? Salt substitute. Salt substitute is potassium. That means you have too much potassium. We should question it. A client on what? Aliskiren. Aliskiren are renin inhibitors. They are the beginning of the renin-angiotensin system. You don't have to worry about the details, but know that they block renin before even lead to decrease in angiotensin 1. Therefore, in the process, they will decrease aldosterone, which is responsible for what? Your sodium. Since they are blocking all these pathways, they can lead to what? Hyperkalemia. Therefore, you should not take it. A client taking what? Triamcinolone is another class of medication. These are potassium sparing. Potassium sparing increases your potassium. Therefore, you should not take it. And as you can see, number one, the next question. Number two, the next question. Number four, the next question. Number five, the next question. Number six, the next question. Those are the patients that they should not take Lisinopril. So that's a problem. So that's the next question. Next question. A client is being discharged on Digoxin for heart failure. Which statement indicate the need for further teaching by the nurse? Digoxin is another class of heart failure medication, cardiac medication that function in three ways. They slow down your heart, they improve the contractility, and then they increase the rhythm of the heart, basically. And it can be used in different form, right? The specific side effect associated with them. Number one symptoms is GI symptoms. If you have GI symptoms, you are in trouble. The best way to remember them is to draw a caricature. I draw it like that. And I said, you start from your head, they have neurological problem. From your eyes is here. They have vision changes. And then your mouth is here, GI symptoms. That's number one. Then your heart, they have cardiac issues. And then your kidney. These are all the side effects to remember Digoxin. Therefore, what is the problem? The client said what? I will inform my healthcare provider if I develop nausea. That's GI symptoms. That's a good thing. I will increase my potassium intake. Well, there's some electrolytes that can affect Digoxin, right? Potassium, calcium, and magnesium. The low potassium causes Digoxin toxicity. But people forget that if you increase your potassium, it's not the good thing. It's supposed to maintain it normal. Unless you're taking other medication that is decreasing your potassium, then you can increase it, but even bring it to normal. Saying I'm going to increase my potassium is a wrong thing. I will need drug level check frequently. Yes, because the Digoxin is very toxic with a narrow therapeutic index. I will check my epical pulse 1 minute before each medication. Yes, because when your heart rate is low, if your heart rate is less than 60 for adult, less than 70 for a child, and less than 90 for a neonate, we got to hold it. So for this patient, we need to check their epical pulse. This is the right information. Therefore, number two is the one we need further teaching. A nurse is preparing to administer Metoprolol through a client. Which assessment finding will require the nurse to hold the medication? This is another medication we've seen. The last name law is a beta blocker. Their purpose is to slow down your heart. They decrease oxygen demand of the heart and they help you slow down. Therefore, when you're using it to answer the question, it's the main thing. Beta blockers, they slow you down. Temperature, 101.5 has nothing to do with slowing you down. Even though it's abnormal, don't let that distract you. The blood pressure is 150/70, should not require you to hold the medication. Probably you may have to give it to you. Respiratory rate of 20 is fine, and a heart rate of 55 That is bradycardia. Therefore, we need to hold the medication for that. Next medication. A nurse is preparing a client for what? Discharge who has been prescribed Enalapril. We've seen it, Lisinopril. The same thing. The class of medication is the most important, not the name. So if you know the class, start with the pill, and you know that they are all what? ACE inhibitors, then that's the key aspect of the thing. The side effect does not matter. The beginning of the medication name is the last name. Which teaching points should the nurse include? You know that they are what? ACE inhibitor. Therefore, you will write it down and say, this is their side effect, and I'm going to use it to answer the question. Rise slowly from a sitting and a laying position. What do you think? Yes, it causes orthostatic hypotension. Therefore, that one, we're going to pick it. This teaching is good. Add fish, avocado, strawberry, tomatoes to your diet. These are all potassium-rich food. You should avoid it, right? Take the medication with food to reduce stomach upset. You don't need to take it with food. That is a trap. Even though it's good in your test, it's a wrong answer. Therefore, this is wrong. You're telling me that it's required to take what? This medication with food. That's what the statement is saying. Check your pulse 1 full minute before the medication. This is not Digoxin. His name is called Enalapril. Expect increased urination when starting the medication. This is not the loop diuretic or diuretic. Therefore, I don't need this. Report a persistent dry cough to the healthcare provider. That's the C there. Yes, you need to do that. Go to the emergency department if jury suddenly feel too tight. If your jury cannot fit, they get tight, you get in what we call angioedema, and that is the A. Therefore, which teaching point should the nurse include? Rise slowly from the position, report persistent cough, and go to the emergency room. So 1, 6, 7. So far, how many have you got? Like I said, stop the video, answer the questions, and then you listen to me how I approach it. How many are you got so far? Put that in the comment and let me know how many you've got so far. We are on round 6. What is the next priority? Teaching for a client on Bumetanide. This is another class of medication. They are diuretic. This specific one is a loop diuretic. Most diuretics are what? Sulfur drug. They cause photosensitivity. They cause dehydration. They cause hypokalemia. What do you think the priority? Avoid sunlight. Photosensitivity is not the priority. The priority is what? Sulfur drug causing Stevens-Johnson syndrome. Second, hypokalemia. Increase fluid intake at night. You're going to pee. You're going to urinate all night. If you drink, you're not going to be sleeping. Change position slowly. It causes orthostatic hypotension. Take on an empty stomach. Most food should be taken with food, but that's not even a priority. The priority is orthostatic hypotension. Therefore, number 3 is the best answer. So these are test taking strategy, questions and answers with explanation, explaining it in detail so that you can, whenever you see it anywhere, you can answer that strategy to answer questions. So test taking strategy, critical thinking, questions and answers using cardiac medication that you have to know, the top 5 class medication and what you need to know. And nurse has provided discharge teaching to a client prescribed what? Verapamil. Verapamil, another class of medication. These are what we call calcium channel blockers. Which statement by the client indicate the need for further teaching? These medications, they look like beta blocker. They slow down your heart rate, but that is not the major function. Their major function, the detailed explanation on calcium channel blocker, they make your vein bigger, venodilator. They make your vessels bigger, and they keep fluid in the vessel. So when they in the periphery, your leg, you get edema. In your face, you get flushing. In the process, that causes what? Hypotension and bradycardia. This is how they do their job. Therefore, based on that content, every time you see that vasodilation and then flushing, edema is common for this medication, then they affect your heart. What do you need to know? They said you need further teaching. Which statement by the client indicate need for further teaching? There's certain things you need to know about these medications that NCLEX will ask you. I will avoid grapefruit juice while on this medication. I will check my blood pressure regularly. I will inform my ACP about my sildenafil. I may feel dizzy when standing too quickly. I don't need to report leg swelling unless it's painful. I need to check my pulse for 1 full minute before medication. What do you think? What are your answers? Put it down and let me know. Number 7, what do you think? Calcium channel blockers? What should you do? I will avoid grapefruit juice while on this medication. That's absolute. There's no need for the teaching. I will check my blood pressure regularly because it causes hypertension. I will inform my healthcare provider about sildenafil. Sildenafil is like Viagra. They are erectile dysfunction medication. They do the same thing as calcium channel blocker. It causes what? Venodilation. If you take both medication, you will have severe hypertension. So that is a good thing. Does not need further teaching. I may feel dizzy when I stand up too quickly. Orthostatic hypotension expected. I don't need to report leg edema unless it's painful. Leg edema is common, but you need to report it to the doctor so that they can adjust your medication. I need to check my pulse for 1 full minute before the medication. This is not Digoxin. Therefore, which one needs further teaching? 5 and 6. I know you got it. And you have 7 out of 7 right now. Next, medication. A nurse is caring for a client with what? Acute myocardial infarction, that's MI, who is receiving what? Atenolol. I don't know what this medication is, but we already discussed it. And we said what? It has a law at the end. Based on that, we've seen the beta blocker. Laws are beta blocker. And what they're going to do, going to slow down your heart. Which of the following findings indicate that the medication is effective? That means effective is working. What is going to happen? Blood pressure is 88/50. That's not what I want it to do. It has dropped your blood pressure too much. It's no more effective. That's critical thinking strategy, right? It's basically you not to be able to feel hypoglycemia in diabetic patient. Going up, it has nothing to do with it. Client reports no chest pain because it decreases oxygen demand for the heart. Therefore, that is good. It has done its job. Patient has a heart attack. Respiratory rate of 29, it means you having problem. That's not effective. If ventricular rate of 75 means he has dropped your heart rate. So that's good. So which one indicate effectiveness? 3 and 5. Once again, if you know, stop the video, answer it, then you can listen to me. That's how you benefit from it. And this is caring for a client with the history of asthma who has been prescribed terminal eye drops for glaucoma. Which of the following findings is most concerning and require immediate follow-up? Stop it. Go back. Look at it. I see glaucoma, but all I see was a medication name called this. It looked like something I've seen before. It has the law. Even though it's going to your eyes, it's a beta blocker. Which finding is most concerning? That means prioritization 101. I got to intervene. Something concerning. I give a patient beta blocker, it's going to slow my heart rate. But this patient, look, there's a buzzword here. He has asthma. Oh, you got to give them selective beta blocker. Otherwise, they're going to have a respiratory problem. Atenolol is not the selective beta blocker. Selective beta blockers are the BAM, which is BAM. Bisoprolol, Atenolol, Metoprolol. This medication can affect your lungs now. Therefore, what do you think? You see, I answered the question based on the content, no even looking at the answer. Intraocular pressure is 18, it's less than 20. That's good. The medication is doing its job for glaucoma. Clients report mild high irritation. That's the side effect of the medication. Clients' sentences are incomplete. He can't hold his breath. If you can't speak in full sentences, it means shortness of breath. If you see that statement in the question on the NCLEX nursing school, please pick it. That's respiratory failure issue. Heart rate of 65 because it's dropping your heart rate, but it's still no bradycardia. Therefore, which one is most important? Number 3 is good. That's what we have to pick. Several clients are on digoxin for heart failure. The nurse should intervene with which situation? We already talked about digoxin. I give you the clue, and I said, draw your boy, bring your leg down, your chest, start with your head, neuro, your eyes, vision changes, your mouth, GI symptoms, your heart, cardiac, bradycardia, and kidney function. If you know all this, you don't even have to memorize, watch any video about digoxin. These are what they're going to ask you. There's another one, few things you have to know is the electrolyte. Potassium, hypokalemia, magnesium, hypomagnesium, hypercalcemia, apical heart rate of 60. This is a child. Licorice, ephedrine for UR symptoms, confusion, and what? Creatinine. Let's go back. Now, let's look at them. Potassium of 3 is hypokalemia. That's a risk factor for digoxin toxicity. Magnesium 1.2, hypomagnesium, risk factor for what? Digoxin toxicity, increases digoxin toxicity because of cardiac arrhythmia. Hypercalcemia also do the same thing, cardiac arrhythmia. A child whose heart rate is less than 60, that's what? Bradycardia for him. You got to intervene. It should be less than, you want to make sure it's greater than 70 and it's less than 60. Therefore, it's 60. Therefore, we should intervene for that one. Licorice causes hypokalemia. Hypokalemia increases digoxin toxicity. Ephedrine is found in cold medication, and that can also cause arrhythmia. Patient has confusion. That's the side effect we saw from the head. Neuro, that's a problem. Serum creatinine 2.3, that's renal failure. That means all 8 patients need to be seen. This is a content level questions to give you all the contents you need to know for digoxin. If you go take the NCLEX or nursing school, one of these information will be there if they ask you a digoxin question. There's one more inside. You should stick around and watch it. A client taking Lisinopril developed a persistent cough. What is the next best action or response? Instruct to increase fluid intake. Reassure that this is normal and temporary. Notify the provider. Advise to take the dose at night. What do you think? You've seen Lisinopril multiple times. I can change it. I can put anything there, but it's a Pril. It's the ACE inhibitor. You know it causes angioedema, cough, electrolyte problem, and teratogenic. Patient has persistent cough. Do you let them increase fluid intake, or you tell them this is normal, or notify the provider, or advise to take the dose at night? Put down your answer or your comment. Stop the video, answer yourself because you got to keep your score. Persistent cough is expected. It's not an emergency, but if it persists, it's a warning sign that we got to modify the medication. Therefore, the right answer is number 3. Instructing the client to increase the fluid. This has nothing to do, it's not a diuretic, right? Reassuring the word persistent defeats that purpose. Advised to take the dose at night. There's no time limit for taking Lisinopril. Therefore, letting the doctor know is very important. This is done to intimidate you so that you know some questions are easy, but it's designed to intimidate you. You know it, don't run away from it. And nurse is caring for what? 4 clients taking Lisinopril. It's an ACE inhibitor. Which client condition is most concerning? The best way to answer this question, think critically. It causes hyperkalemia. What will affect your hyperkalemia? Your kidney function. The rest is history. Client A has potassium 3.5, client B has 3.6, client C 4.1, and client 4D 4. The creatinines are different. Whoever has higher creatinine is the one you should worry about, unless the potassium is already high. But the highest potassium I see is 4.1. And I see the highest creatinine is what? 2. The heart rate, it does not affect your heart rate. So I'm not even worried about it. That's a trap. Therefore, which patient we should worry about? The one with the higher creatinine. Number 4. This is the strategy. You can answer questions. You have to go with the buzzwords, and the buzzwords are the key in the question. It's Lisinopril, most concerning. 13. 6 clients are on Digoxin. This is what I promise you for heart failure. The nurse should intervene in which situation? We've seen Digoxin, another class of medication, the biggest of all. What do you think? There's a certain criteria. There you have to know. We've talked about it. If you're an adult, your heart rate less than 60 is a problem. A child, 70 is a problem. A neonate, 90 is a problem, right? And there's certain electrolytes. Number 1, signs and symptoms is a GI symptoms. Therefore, what do you have? An adult with the apical pulse of what? 100. A child who vomits 1 dose of Digoxin in the morning. Child who has no appetite. Adult with a yellow vision. Neonate with ventricular septal defect. A child with severe what? Diarrhea. Whose situation should you worry about? Which situation should we intervene? Think about it. Test-taking strategy. Stop the video, answer it on your own, and then listen to me. This will give you some idea on how I'm going to approach it. I know that if your heart rate as an adult is less than 60, is a problem. Your apical heart rate is 100. You're good. A child who vomits 1 dose, that means we cannot give them another dose in the morning, but we got to check for them because it may be early signs of what? Digoxin toxicity. That's GI symptoms. A child who has no appetite, that means worse GI symptoms. They have anorexia, that's bad. Adults with a vision change, that means they already have toxicity. They may be having a neurological problem and a vision issue. A neonate with ventricular septal defect is a trap, is a big word. It means what? Cardiac problem. And these VSDs causes what? Left to right shunt. And then lead to what? Heart failure. That is why this patient may be on Digoxin. It's what is the medication is being used for. It's not contraindication. If you have severe diarrhea, it causes dehydration, and you will have Digoxin toxicity. Therefore, which patient should the nurse intervene? Number 2, we got to check on him. Number 3, we got to check on him. Number 4, we got to check on him. And of course, number 6. So these are little questions. You need to master them because that's what the NCLEX or nursing school asks you. This is the same thing. A nurse is teaching a client with a heart failure who has a new what? Prescription for what? Spironolactone. The nurse should teach the client to avoid the following food. Select all that apply. Spironolactone is a potassium sparing. Therefore, if it's potassium sparing, I should not take any potassium good. So teach me to avoid what? Spanish, strawberry, whole grain, avocado, tomatoes, kale, and banana. If you don't know, this is the best way to know which food has high potassium. Google it. How about that? Easy way. But me, the way I do it, I use FAST. F, fish, avocado, strawberry, and Spanish. Those 4 is always going to be there. Spanish, strawberry, avocado, and tomatoes are always going to be there. Everybody know about what? Banana. And then you can add the cow. All grain has no potassium. Therefore, 1, 2, 4, 5, 6, 7 have potassium in it. Like I said, this is a teaching video to give you questions and answers with the detailed rationale. So that's why I'm giving you all those information that they may ask you. But this is questions and answers, practice questions, answers, and detailed rationale. Pharmacology, right? Pharmacology, drug on cardiac medication. Number 15, and this is the last question. You know it. It looks difficult, but not. So select or apply. That's why it's designed like that. But guess what? You're going to ace it. Let's break it down. And let's care for several clients, a bunch of them, 6. Which client situation the nurse should intervene? Select or apply. 1. Client on what? Furosemide, which is what? Loop diuretic, is reporting muscle cramp. Client on chlorothalidone reporting mild dizziness when upright. This is hydrochlorothiazide derivative. The client on what? Spironolactone, a potassium sparing with the peak T wave. The client on spironolactone with what? Bilateral gynecomastia. Client on what? Hydrochlorothiazide, and he has what? Glucose of 200. Client is on furosemide with the small purple rash on the torso. What do you think? Last question. I know you're keeping the score. How many have you got? We got to get this. What do you think? Let's start with the number 1. Like I said, put down your answer. You stop it in the comment section. You say, oh, I get 12 out of 12, 15 out of 15. This one, first one, furosemide is a loop diuretic. It's a sulfur drug. It causes hypokalemia. Signs of hypokalemia, it's muscle cramp. That situation we got to worry about. Chlorothalidone is hydrochlorothiazide derivative. They also diuretic. They cause hypokalemia. They increase your glucose. They causes uric acid to increase. Those are all signs. But because of orthostatic hypotension, report mild dizziness when upright is not something you should intervene. Spironolactone with the peak T wave is a potassium sparing. Peak T wave is high potassium. Therefore, we should intervene. Gynecomastia is a side effect from what? Spironolactone, because it has a steroid-like effect. You grow boobs, breasts, if you're a male. That is not something we need to intervene right now. Hydrochlorothiazide with the glucose of 200. Guess what? It causes hyperglycemia. But in this situation, you got to intervene. You got to follow up on it. Because we give you a medication that is affecting, if this is one medication alone, but this is selected apply. So this is something you got to like intervene and figure out what is going on with it. But you will need some form of follow-up. You can't ignore it. The medication is causing glucose to go up. Furosemide with the small purple rash on the torso. This is Stevens-Johnson syndrome. That's going to kill you. That's sepsis. 15 questions, top 5 medications in cardiac medication, the class of it, using questions and answers and practice detailed rationale, critical thinking. Thank you for watching. I hope you follow the series. This is the first series, 15 questions each. Pharmacology, drugs that you need to know for your NCLEX. Take care of yourself. Bye.